Does Medicare pay for hospice care? Yes, it pays for nearly all of it, and for most families, the care itself costs nothing. That's an unusual sentence to say out loud about American healthcare. Almost everything else arrives with a deductible, a percentage, and a surprise letter 3 weeks later. Hospice genuinely doesn't work that way. So here's the direct answer, before anything else. Hospice is covered under Medicare Part A, and there's no deductible for it. The nurses, the doctor visits, the medication for pain and symptoms, the hospital bed that appears in the living room, the aide who helps with a shower, the social worker, the chaplain, and the counseling your family gets after the death. All of it paid for. But there is one bill Medicare will not touch. Families report it running around $200 a day, and most of them only find out about it while they're standing in the middle of it. That gap is the reason this video exists. By the end, you'll know which parts of hospice are genuinely free, which parts aren't, what happens if your mother lives longer than 6 months, and the one question worth asking a hospice before you choose one. Qualifying has nothing to do with your age or your income. It's about a prognosis. To elect the Medicare hospice benefit, a doctor has to certify that you're terminally ill, and that if the illness runs its normal course, you have 6 months or less to live. In practice, that's usually 2 signatures, your own doctor and the hospice medical director. Then you sign an election form. That form is the part people skim, and it's the part that actually matters. By signing it, you're telling Medicare you're choosing comfort care for your terminal illness instead of treatment aimed at curing it. Notice how narrow that is. You're only setting that aside for the terminal illness itself. Everything else about your Medicare stays exactly where it was. If someone's on hospice for heart failure and then breaks a wrist, the wrist gets treated and billed the ordinary way, under Part A and Part B, as if hospice never happened. That one distinction runs through this whole benefit. Related to the terminal illness, hospice pays. Unrelated, regular Medicare pays. Hold on to it, because in a few minutes it explains a bill that confuses almost every family. So what does signing that form actually buy? A team, mostly. Not a building, a team. A hospice nurse who visits on a schedule and is reachable by phone at any hour. A hospice doctor overseeing the plan of care. An aide for bathing and personal care. A social worker for the paperwork nobody has the energy for. A chaplain if you want one. Then the physical things. Medication for pain and symptom control delivered to the door. Durable medical equipment, which is the bloodless term for the hospital bed, the wheelchair, the oxygen concentrator, and the shower chair, ordinary supplies. Physical therapy, occupational therapy, and speech therapy, where they're part of comfort. Dietary counseling. And one piece that surprises people every single time. Grief counseling for the family, which continues after the person has died, typically for about a year. The benefit doesn't stop at the funeral. Price that list at retail and you're looking at thousands of dollars a month of professional services. Under the hospice benefit, the family's share of it is zero. Here's something the paperwork rarely spells out. Medicare doesn't pay for one kind of hospice. It pays for 4 levels, and your person can move between them as things change. Routine home care is the one almost everybody gets. Scheduled visits, wherever home happens to be. More than 95% of all hospice care days in America are this level. Continuous home care is for a crisis. When symptoms get out of control and the alternative would be an ambulance, hospice can put at least 8 hours of nursing and aide care into a 24-hour period at home. It's built for short stretches, not for weeks. General inpatient care is that same idea in a clinical setting, for when symptoms can't be managed at home. Short-term and specifically for getting symptoms back under control. Inpatient respite care is the one that exists for the caregiver rather than the patient. Your person goes into an approved facility for up to 5 consecutive days so you can sleep or go to a wedding or simply stop for a moment. 4 levels, 1 benefit. You don't apply for them separately. The hospice team moves you between them. So where does money actually change hands? Two places, and both are small. The first is prescriptions. For outpatient drugs for pain and symptom management, Medicare allows a copay of up to $5 per prescription. Some hospices charge it, plenty don't. The second is respite. For inpatient respite care, you pay 5% of the Medicare-approved amount. There's a ceiling on that. Your share can't be more than the year's inpatient hospital deductible, which for 2026 is $1,736. In practice, nobody comes close to the ceiling on a respite stay. Reported figures for a 5-day stay tend to land somewhere between $80 and $150. That's the whole list. $5 a prescription and a modest share of respite. Set against a nurse, a doctor, the drugs, the equipment, and a year of grief support, those are rounding errors, which is exactly why the next one hits so hard. Medicare does not pay for room and board, not at home, not in a facility, with one narrow exception. Read that twice, because it's the single most common thing families learn too late. Hospice pays for care. It does not pay for a place at home that costs you nothing extra because you already live there. That's why this benefit feels completely free to most families, and for them it very nearly is. But move the same person into a nursing home, an assisted living facility, or a residential hospice house, and the rent, the meals, and the day-to-day custodial help become a separate bill. Medicare doesn't touch it. Neither does a Medicare Advantage plan, and neither does a Medigap policy. Families who've paid it commonly report figures around $200 a day. That's roughly $6,000 a month, arriving in the worst month of their lives. The exception is narrow, but it's real. When the hospice team decides your person needs short-term general inpatient care or respite care, and the team arranges it, Medicare covers that stay. The trigger there is the hospice team's clinical decision, not the family's preference. When the money isn't there, Medicaid is usually the answer. For people who qualify for both Medicare and Medicaid, Medicaid commonly covers the nursing homeroom and board, while hospice covers the care. State rules and financial tests apply. So that's a real conversation with the facility's business office, not something to assume. Room and board is the big gap. There are 3 smaller ones, and they come from the same election form. Treatment intended to cure the terminal illness is no longer paid for while you're on hospice. That isn't a penalty. It's the trade you agreed to when you signed. Prescriptions meant to cure that illness, rather than manage its symptoms, fall under the same rule. This one catches families constantly. One caregiver described it plainly. The drugs her hospice counted as related arrived at the front door for free, and everything else came back as an ordinary prescription she paid for at the pharmacy. And care from a provider your hospice team didn't arrange isn't covered either. Go around the team and you're paying. The way out of all 3 is that same word, related. Anything unrelated to the terminal illness runs on your regular Part A and Part B, exactly as before. So when you're unsure which side of the line something sits on, ask the hospice before it happens, not after the bill lands. If you're on a Medicare Advantage plan, this next part now used to be genuinely confusing. It isn't anymore. Hospice is carved out of Medicare Advantage. The moment you elect hospice, care for your terminal illness is paid by original Medicare, even though you're still enrolled in the Advantage plan for everything else. The plan keeps covering your unrelated care. Your extra benefits stay where they are. For a few years there was an exception to that. A demonstration program let some Advantage plans carve hospice in and run it themselves. It ended on the 31st of December, 2024, after too few plans joined for it to prove anything. So in 2026, the answer is the same for everybody. Whatever card is in your wallet, the hospice benefit itself belongs to original Medicare. You do not have to drop your Advantage plan to use hospice. That's a myth worth killing. Now the question that quietly worries every family. What if 6 months goes by and your person is still here? Nothing bad happens. 6 months is a prognosis, not a countdown, and plenty of people outlive it. The benefit is built in periods. 2 periods of 90 days each, then an unlimited number of 60-day periods after that. At each one, the hospice doctor recertifies that the prognosis still holds. From the 3rd period onward, that recertification also needs a face-to-face visit with a hospice doctor or nurse practitioner. So it's a review, and that review can carry on for years. If someone genuinely improves and no longer meets the criteria, they're discharged alive and their regular Medicare coverage picks straight back up. And you can leave yourself at any time. The federal rules let you revoke the hospice election whenever you want, for any reason, and go back to curative treatment under standard Medicare. Nobody is locked in. That election form is a choice, not a contract. One question, if you take nothing else away from this: when you're choosing a hospice, ask them plainly, what will we be billed for, and where will he be living while this is happening? Care versus place. That single question surfaces the room and board gap before it surfaces you. So, does Medicare pay for hospice care? It covers the entire care side under Part A with no deductible. What's left for you is a $5 drug copay and a small share of respite, and it pays nothing at all toward rent, meals, and a bed in a facility, knowing that now, while it's still abstract, is worth an enormous amount more than reading it off a form in a hospital corridor at 2 in the morning. If you've been through this with someone, what's the one thing about the hospice benefit you wish somebody had told you before you signed? Put it in the comments. Somebody reading them this week genuinely needs to hear it.